There's a few barriers involved with checking your blood sugar with a meter. Meters usually you can get for free, so that's not going to be the issue, but the issue is the ongoing cost of the strips. If people have insurance, usually the insurance will pay for it, but not always. Some people have a very large copay, or they have to meet a certain deductible before those things kick in. So that's something you might want to look at. Another barrier would be the actual pricking your finger once, twice, 3, 4 times a day. That can get old. People get tired of it. People forget it. A patient told me one time, it's not that it's hard to remember, it's just so easy to forget. In your daily life of running between things for work, picking up your children, taking kids to soccer, getting your car fixed, getting your inspection sticker, taking care of all the things you have to do every day, then you have to remember several times a day before you grab something to eat that you have to check your sugar. Sometimes that's hard to do. I'd like to recommend that you work this into your daily schedule. You'll set your meter out where you could have it handy. Put it by your toothbrush. So the first thing in the morning you get up, you brush your teeth, you check your blood sugar. So at least you know where you're starting the day out. If you're already starting the day out at 300, well, you might make some decisions about, making sure you take your medicine, watching what you have for breakfast. You might want to try to be a little more active that day. If you check your blood sugar, it's between 80 and 120, 130. Well, you're doing good so far. If it's too low, you might need, if it's below the 80, if it's at 60 or 70, you might want to make a documentation and note that so that you are kind of a little more careful with your activity. You might want to consider making some changes to your medication, or you might want to consider having a little extra carbohydrate at your breakfast to bring your sugar up just a tad bit, a little closer into your range. Again, especially if you're going to be having a busy day. Sometimes people have some problems with doing this out in public. That's another thing. People don't like people at work to know they have diabetes. There's still a certain stigma about it. And so there's many people in different fields that, again, they're not real open about the fact that they have diabetes, so they certainly don't want to be checking their blood sugars out in public. A lot of people are squeamish about the whole blood idea. They don't like seeing their own blood. They don't want other people seeing their blood. The first time you pull it out and somebody goes, "Ooh, what are you doing?" It's not a positive type of feeling. So there's a lot of things that can be barriers to people checking their blood sugars. Probably the best thing you need to remember is that this is your body. You need to decide what's best for you, and you need to do some routine maintenance. The same way you should be checking the oil in your car, checking the gas levels, making sure that you're getting the tires rotated, that you've got plenty of air pressure in your tire. You need to do the same thing with your body occasionally. You can always buy a new car, but you're not going to get a new body. So you need to make sure that you take care of it for the long haul, and you know where your diabetes numbers are and how well you're controlling yourself.